Hello, my name is Cassandra and today I'm going to be presenting the topic of prostate cancer. Prostate cancer is a cancer that forms in the tissues of the prostate. The prostate is a gland in the male reproductive system that is located below the bladder and in front of the rectum. Prostate cancer is usually a slow-forming cancer with no symptoms until it is in an advanced stage. Prostate cancer usually affects males in older age, usually over age 65. In the U.S., 80% of cases occurred in men over 65 and less than 1% occurred in men under 50. African American men are at a higher risk of developing prostate cancer and have a higher death rate than white males. Prostate cancer is rare in certain parts of the world, such as Asia, Africa, and Latin America. Some factors that contribute to the development of prostate cancer are a family history of the disease, a diet that includes a lot of red meats. The harmful thing about red meats are the fats and also the hormones. The hormone testosterone is found in red meats, and this hormone has been found to spread the growth of prostate cancer. Certain jobs also pose a risk because they expose the workers to frequently expose the workers to a metal named cadmium, and these occupations include welders, battery manufacturers, and rubber workers. Lack of exercise also plays a role in the development of prostate cancer. Now, there are usually no symptoms of prostate cancer until it is in an advanced stage, such as if the prostate has swelled or the cancer has spread beyond the prostate. Once the tumor has caused the gland to swell, most symptoms include problems with urination, such as the need to urinate frequently, mostly at night, difficulty stopping or starting a stream of urine, a weak or interrupted urine stream, painful or burning sensation when urinating, or blood in urine or semen. Now, advanced prostate cancer symptoms include more severe pain, such as deep, dull pain or stiffness in the pelvis, lower back, ribs, upper thighs, or pain in the bones of these areas, loss of weight and appetite, fatigue, vomiting, or nausea, swelling of the lower extremities, and weakness or paralysis in the lower limbs, along with constipation. Now, before I describe the stages of prostate cancer, I want to describe the 3 ways in which cancer can spread. The first is by invasion, which is growing into neighboring tissues. The second is spreading through the lymph system, which includes lymph nodes and lymph vessels. And the third is metastasis, which is through the blood to distant tissues. Now, there are 4 stages of prostate cancer, depending on the size of the tumor and how far it has spread. Stage 1 of prostate cancer, seen here in the upper picture, is microscopic in size. The cancer is still located in the prostate gland and has not extended beyond it. Now, most men in the United States, over 85% of American men, are diagnosed in this stage. In stage 2, the tumor has grown, as you can see here, but has not extended beyond the prostate gland. In stage 3, it has grown outside of the gland to neighboring tissues. And in stage 4, cancer has spread to large areas of the body, such as in the lymph nodes, the bones, the liver, or the lungs. Treatment of prostate cancer depends on many factors, such as the grade and severity of the cancer, the patient's age, lifestyle considerations, and other important illnesses or factors such as illnesses that the patient may have. Now, because men usually develop prostate cancer later in life, many will die with prostate cancer, but not from prostate cancer. They may have other illnesses and die without having it treated. There are 8 common types of treatment that occur in the United States, such as watchful waiting or active surveillance. This is usually done with older males, as I said before. Surgery, radiation therapy, hormone therapy, chemotherapy, biologic therapy, biosphosphate therapy, and targeted therapy. Now, there are new treatments being tested on patients, and some of these are cryosurgery or cryotherapy, In this process, ultrasound is used to identify the area that needs to be treated, and then an instrument is used to freeze and destroy prostate cancer cells. The second is a high-intensity focused ultrasound. In this process, an ultrasound waves destroy cancer cells, and an instrument named an endorectal probe is used to make sound waves in the body. The third is an innovative technique named proton beam radiation therapy.
I saw the lightning! It was lightning!
In this procedure, a type of high-energy external radiation therapy targets tumors with streams of protons, which are small, positively charged particles. Now, some tips to prevent cancer are exercise regularly, follow a healthy diet, and avoid large amounts of red meat. And also, an important factor is to get screened regularly. Men who are age 50 and older are encouraged to get screened once a year and to have a digital rectal examination and blood testing for prostate-specific antigens. If you are in a high-risk group, such as if you are African American or you have a family history of prostate cancer, then you are recommended to have your first screening at age 40. Here are some links that I've included if you wish to follow up on prostate cancer, and some words of advice that I have are to take into consideration your background and your health factors, and if you know you're at a high risk for developing this cancer, be proactive about your health and follow through with preventive screening. Thank you.